Hi, I'm Dr. Emmy Graber. I am a board certified dermatologist practicing in Boston, Massachusetts, and I am treasurer of the American Acne and Rosacea Society. At the AAD this year, I gave a talk on lasers and light devices for treating acne and rosacea. And while I covered a broad range of devices, a good chunk of my talk focused on the newer 1726 nanometer laser devices for treating acne. There are two FDA cleared devices of this type on the market today, and we have some good studies that show us that these devices truly work for acne. And I've had a lot of experience with the 1726 nanometer laser in my office for treating acne, and I found the same to be true, and that it really can work great for some patients. And a few key points I made in my lecture were pearls that I want to give you for counseling patients on these lasers. Even if you don't have them in your office, if you have a patient coming in and inquiring about this laser for acne, here is what you should know. First of all, for the 1726 nanometer lasers, it takes several treatments, usually around 3 treatments. And the results are not immediate. Patients have to be patient. Unfortunately, we don't have that quick magic wand for our patients yet with acne that can make it go away the next day. They have to wait months until the results are seen. Sometimes even not until months after the third treatment was done. So they have to be patient. Now, secondly, to know about these lasers is that the results can be long lasting. We have data that these results, patients can be clear or almost clear for even up to a year or perhaps longer afterwards. So this is a device that offers long enduring improvement. Another thing to know about these lasers is that patients may experience a temporary flare up of their acne for days to weeks after each treatment. It's not seen in everyone, and it is more common with the first treatment, but it can occur after any treatment number, the first, second, or the third. And we see this with some of our other acne therapies, such as our topical retinoids, that there is this what patients call a purge. The same thing can be seen with these laser devices. Fourthly, to remember with these lasers is that they have been shown to be very safe and safe in all Fitzpatrick skin types. And that's so important to know for your patients. At my AAD session during this talk, I got a lot of questions about my point about the durability of the results. I mentioned that some patients saw improvement at least a year out. So a question I got asked a lot, well, wait a second, what other acne treatments were these patients doing? And in fact, the one study that was published in the JAAD was a monotherapy study. Patients weren't using any other treatment for the whole year that they were followed after their 3 laser treatments. So, and during the laser treatments, they also weren't on any acne therapy. So it was really the laser alone that was keeping them clear for that year afterwards. Now, in clinical practice, as I said, I've used the 1726 nanometer laser a lot in my practice. I do things in combination. I have a small handful of patients that only want to do the laser, but I usually encourage them to be using other acne treatments along with the 1726 nanometer laser. I have some patients who are on concomitant topicals, such as topical retinoids. I have a lot of my adult female patients also on spironolactone, and perhaps they were doing spironolactone and were improved, but not great. And so they decided to add in the laser treatment. Well, I kept them on the spironolactone and they saw great results. I had some patients also on oral antibiotics who were doing the 1726 nanometer laser. So while these studies are often looked at as monotherapy, and we do know that we have great results with this laser as monotherapy, in clinical practice, we often do things in combination. And I have found that in my hands, it is safe to do so.